Hello everyone, and thank you for inviting me to speak to all of you today. I'm grateful for the chance to address this diverse group about the role that you're playing in our fight against COVID-19 and broader efforts to deliver American patients better care, more choices, and lower costs. I want to begin by thanking both the Medicare Advantage plans that many of you represent and all of the partners within BMA for your efforts to combat COVID-19. These have been unprecedented and challenging times for our healthcare system and for many older Americans who are covered by Medicare Advantage, especially those who have conditions that put them at increased risk for severe disease. I know that many of you have worked to check in on vulnerable patients and ensure that they can continue to receive the care and services they need, and we are deeply appreciative of those efforts. Today, I want to talk about how the experience of COVID-19 has taught us about the need for a patient-centered healthcare system and how we've used Medicare Advantage to move toward that goal long before this crisis began. One of the instructive experiences from COVID-19 has been the vastly expanded role of telehealth. Thanks to historic flexibilities led by President Trump, we went from about 14,000 virtual visits in Medicare fee-for-service each week before the pandemic to nearly 1.7 million virtual visits a week at the peak. There's no undoing this revolution. We believe patients will start to see telehealth as a durable and desirable part of their healthcare experience. The future gold standard of care will integrate both in-person services and telehealth, customized around the patient's needs and their doctor's advice. We've already worked over the past several years to create permanent flexibilities like this in Medicare Advantage, expanding the ability for plans to pay for virtual check-ins in a wider variety of circumstances, allowing patients to receive this care from the convenience of their home rather than a doctor's office. Expanding telehealth, including in MA, is also part of our broader work to improve rural health under President Trump, which has included efforts to improve MA plans' ability to compete for patients in rural areas. Telehealth is just one example of how COVID-19 will inform our efforts to deliver Americans a patient-centered system with better care, lower costs, and more choice, a vision that I know all of you are working toward through your creative partnerships. More broadly, we've seen during COVID-19 how health disparities, including in the prevalence of chronic conditions like diabetes, have put some patients at dramatically higher risk for severe disease. We want to support you in addressing these disparities and health challenges in a holistic way, and that has informed our efforts to expand the array of supplemental benefits that MA plans can offer. I know that as a coalition, all of you have made it a priority to address social determinants of health, and that is an area of great interest for us as well. Addressing costly and debilitating chronic conditions can sometimes be impossible without addressing particular non-health needs. And MA allows you to do that in a way that focuses on value, outcomes, and a patient's individual needs. The good news is that as we expand these benefits and take on these challenges, MA continues to become more and more popular and more affordable. Since 2017, the average monthly MA premium has decreased by about 34%. For the 2021 plan year, the average monthly premium will be the lowest it's been since 2007. The number of plan choices increased by 76% since 2017, and the number of plan choices available in rural areas has steadily increased as well, in part thanks to flexibilities we rolled out last year. Medicare Advantage is a success story because it allows payers to focus on what really matters to patients: health and outcomes. That focus on health and outcomes rather than procedures and sickness is the ultimate goal of the agenda for value-based transformation that I laid out when I became secretary in 2018. That agenda included interoperable and accessible health IT, transparency around price and quality, bold use of experimental payment models, and removing government burdens that impede care coordination. Today, we've made remarkable progress on that agenda. American patients are entering a new era of price transparency, and the information they need will soon be easily at their fingertips. We've launched payment models that will transform kidney care, primary care, cancer care, and other areas by paying for outcomes rather than procedures. We updated the highly successful value-based insurance design model for MA, which is now projected to enroll 1.6 million seniors in 2021. We've finalized changes to substance abuse privacy rules and are working to finalize historic changes to the Stark and anti-kickback rules. As I mentioned to many of you last year at the in-person BMA gathering, these changes are part of delivering not just a value-based healthcare system, but also President Trump's vision for American healthcare, an affordable, patient-centered system that puts you in control and treats you like a person, not a number. Amidst all the pain caused by this pandemic, we've seen how creative and innovative America's healthcare system can be. I'm grateful for what you've done to help us battle COVID-19, and I look forward to continued work with all of you to finish this fight and lay a foundation for a healthcare system with better care, more choice, and lower costs in the years to come. Thank you.